So before we get started, we'd love to share our rap song introduction video, and we hope you enjoy.
Yeah, okay, organic base, this is what you need. Take you to the future, live a life that can be disease free. All these toxins are taxing on our bodies, no doubt. All these GMOs and these processed foods we can live without. Yeah, wanna see you live a long time. Contaminants in our water and our food supply. From the meat to the dairy and the fish, what a shame. Not realizing that my insides were inflamed. Hold up, I know it's hard to digest, that's right. I found an organic plant-based website. I even got the app, yo, this is where it's at. Promoting a healthy life, it's time to put it on the map. Assuaged, trust you don't wanna miss. It's time for you to be your best, be your healthiest. Assuaged, trust you don't wanna miss. It's time for you to be your best, be your healthiest. Hey, Assuaged, let's go.
Global COVID-19 Management, Policies and Health Professional Perspectives. Student speakers, Rylowicz, Zuha Mehdi, Blanca Morales, Karizza Cordero, Matthew Ginzburg. Slide contributors, Sarita Tamang, Matthew Ginzburg, Kadeza Ahmed, Karizza Cordero. Thank you, Restream, for supporting our student team. Restream's powerful multi-platform streaming capabilities have broadened our reach, connecting us with diverse communities across various social media platforms. Our message of public health and wellness now reaches those who need it the most. Agenda 1. Introduction and overview of COVID-19. Early response to the pandemic. Global health policies for containment. 2. Challenges in healthcare delivery, information overload and misinformation, variants of concern, vaccination challenges. 3. Economic and social implications of policies, vaccine development and distribution, health professional perspectives. And then 4. Conclusion and student discussion, recap of key points, success stories and future directions, and lastly, discussion questions.
Overview of COVID-19. The etiology is that COVID-19 is a highly contagious respiratory infection caused by the coronavirus named SARS-CoV-2. It was first identified in December of 2019 in Wuhan, Hubei province in China, and the World Health Organization first declared it as a pandemic on March 11th of 2020, with over 118,000 cases in 114 countries and a total of 4,291 deaths. How COVID spreads, the primary mode is from person to person through respiratory droplets. The secondary mode is through contact with contaminated surfaces, and the infectious period is 2 days before and 10 days after symptoms onset. Symptoms vary from mild to severe or asymptomatic. Common symptoms include fever, dry cough, tiredness, new loss of taste or smell, aches and pains, sore throat, diarrhea, headache, nausea, or vomiting. And severe symptoms that require urgent medical attention include difficulty breathing, persistent chest pain or pressure, loss of speech or movement. The cumulative number of COVID 19 cases worldwide reported to the World Health Organization uh, is about 774,834,251 reported cases until March 3rd of 2024. The global statistics in terms of total deaths are 7,037,007 reported cases till March 3rd, 2024, from the World Health Organization. In the United States, which is the highest, we had about 1.2 million deaths. In Brazil, 702,000, and in India, 533,000. The total vaccinated, 70.6% of the population worldwide, including 32.7% of low-income countries' population, at least a single dose. And the end of the emergency phase was May 2023, according to the World Health Organization. The timeline of COVID-19, it started in January of 2020. An outbreak was detected in Wuhan, China, and it was linked to a seafood market. The World Health Organization declared it a public health emergency of international concern. By April of 2020, COVID-19 cases surpassed 1 million globally, and many countries have implemented lockdowns and social distancing measures. In December of 2020, Pfizer, Moderna, and other companies announced successful vaccine trials. Vaccination campaigns began in several countries. By September of 2021, Pfizer and Moderna vaccine booster doses were authorized and administered. And from 2022 to present, variants of the virus continue to emerge, necessitating ongoing monitoring and adaptation of public health strategies. The early response to the pandemic was rapid and decisive. Um, uh, Action proved to be imperative. The World Health Organization led issuing vital global guidelines to navigate the COVID-19 crisis. Many public health agencies and healthcare systems swiftly mobilized, establishing testing infrastructure and diagnosis protocols. Concurrently, infection control measures, including mask mandates, were enforced alongside extensive public awareness campaigns. International collaboration monitored virus spread, guiding healthcare providers while prioritizing vulnerable populations in vaccine research and distribution. Continuous monitoring facilitated timely adjustments, ensuring an effective pandemic response. Here we have two case studies of early containment. The first one was in Wuhan, China. They implemented strict lockdowns, closing transportation and public spaces, confining residents. Mass testing and tracing used makeshift centers and mobile units. Temporary hospitals quickly expanded healthcare capacity, particularly relieving strain in Wuhan. Medical personnel from other provinces aided COVID-19 patients and eased local facility pressure. While in South Korea, they aggressively tested and traced cases using drive through and mobile units, leveraging technology for monitoring and quarantine enforcement. Transparent communication built public trust, while campaigns encouraged social distancing and mask wearing, which were widely adopted by the population.
Global health policies for COVID-19 management, lockdown and social distancing measures, objective, to reduce virus transmission through minimized contact. Implementation, different countries adopted these measures, varying in degrees based on severity, ranging from strict stay-at-home orders to recommendations for maintaining physical distance in public spaces. Impact, proven effective in reducing new cases, but with economic, psychological, and social costs. Global health policies for COVID-19 management continued. Testing strategies and contact testing. Objective, to reduce further transmission, identify and isolate infected individuals, and notify those in close contact with confirmed COVID-19 cases. Strategies and methods. widespread to targeted testing, manual and local tracing supplemented by digital tools and apps, and local health administrations. Outcomes, enhanced testing capacity, face challenges such as public cooperation, extensive resources, and privacy concerns. Global health policies for COVID-19 management continued once more. Travel restrictions and border control. Objective, to prevent the virus from spreading across borders. Implementation, closing borders, mandatory quarantine periods for incoming travelers, and the complete suspension of international flights. Outcomes, effective in controlling case importation through severely disrupted international travel and economies, and then other global policies such as mask mandates and use of PPE, known as use of personal protective equipment, healthcare system preparedness and capacity building, and lastly, public health communication and education.
Vaccine development. Clinical studies, clinical trials, phases 1, 2, and 3, regulatory approval, and manufacturing. Preclinical studies evaluate vaccine safety and efficacy in laboratory and animal models, followed by clinical trials to assess safety, immune response, and human effectiveness. Regulatory authorities review trial data before approving vaccines for distribution. Vaccine development and distribution continued. Vaccine development for COVID-19 comes in different types. mRNA vaccines use genetic instructions to make a harmless protein that trains the immune system. Viral vector vaccines employ a harmless virus to carry COVID-19 genetic material, prompting immunity. Protein subunit vaccines contain safe virus pieces to stimulate immunity. Inactivated vaccines use a weakened virus to trigger an immune response. Distribution prioritizes high-risk groups like healthcare workers and the elderly, deploying vaccines via healthcare facilities, pharmacies, and community centers to ensure equal access worldwide. Global Collaboration Efforts COVAX Initiative. COVAX, also known as the COVID-19 Vaccines Global Access, is spearheaded by the World Health Organization, Coalitions for the Epidemic Preparedness Innovations, CEPI, and Gavi, the Vaccine Alliance. COVAX aims to provide fair access to COVID-19 vaccines globally, especially for low and middle income nations. By streamlining vaccine procurement, distribution, and delivery, COVAX accelerates production and ensures equitable distribution, prioritizing vulnerable communities.
Different vaccines effectiveness. Top vaccination companies. The top 4 COVID-19 vaccines, from left to right, are Pfizer, Moderna, Johnson & Johnson, AstraZeneca. The percentages listed are for preventing symptomatic COVID-19 infection. The percentages for severe/critical infection are lower by an average of 21% compared to the effectiveness of symptomatic COVID-19 and are not listed. How well each vaccine prevents you from getting sick with COVID-19 symptoms. Pfizer, 95%, Moderna, 94.1%, Johnson & Johnson, 85%, AstraZeneca, 70%. Challenges in vaccine distribution and equity. Vaccine distribution faces challenges in ensuring fairness and accessibility. Supply shortages, logistical hurdles, and unequal access hinder equitable distribution. Additionally, reaching remote areas poses logistical challenges, and misinformation may affect vaccine acceptance. Strategies like prioritizing high risk groups and global collaboration efforts are crucial to address equity. Overcoming these challenges requires coordinated efforts, transparent communication, and innovative solutions to ensure everyone can access vaccines regardless of location or socioeconomic status. Health professional perspectives. Challenges faced by health professionals. Shortage of personal protective equipment or PPE. Overwhelming workload with limited breaks and long hours. Lack of training in disease management and new equipment/protocols. Inconsistent information on evolving viruses and treatments. Limited information on vaccine effectiveness. Logistic and technical challenges. High risk of personal infection and transmission to family members. Roles of health professionals in COVID-19 public awareness. Public education. Health professionals have been in charge of educating the public about COVID-19 prevention measures, vaccine efficacy, and safety protocols, utilizing both traditional media and digital platforms. Combating misinformation. Amid widespread misinformation and disinformation, healthcare workers have taken active roles in debunking myths, providing accurate information, and building public trust in science-based guidelines and vaccinations. Mental health impacts on health professionals during COVID-19 pandemic. Health professionals face substantial mental health challenges amid the pandemic, experiencing burnout, anxiety, depression, and post-traumatic stress disorder due to patient loss, resource allocation dilemmas, and high-risk environments. Recognizing this, tailored mental health support services, such as counseling and peer support programs, are increasingly acknowledged as essential alongside efforts to destigmatize seeking help.
Economic and social implications of policies. Economic implications. The economic downturn stemming from COVID 19 includes decreased economic activity due to closures and restrictions, escalating unemployment rates, and disrupted supply chains. This results in reduced consumer spending, necessitating targeted lockdowns and support measures. Investing in public health and fostering collaboration among experts, policymakers, and economists are crucial for recovery. Social implications. COVID 19 policies have led to disrupted education, widening the education gap and having a negative impact on mental health due to isolation and uncertainty. Marginalized communities suffer disproportionately from job losses and resource access issues, exacerbating existing inequalities. Healthcare systems and essential workers face strain, resulting in burnout and heightened stress. Challenges in healthcare delivery. Conflicts and shortages impede COVID 19 management, worsening healthcare disparities. Information overload and misinformation hinder guidance dissemination, affecting public trust. Variants and vaccination hurdles threaten containment, necessitating Adaptive strategies. Global surveillance and data sharing are vital for monitoring and response. Persistent challenges include vaccine hesitancy, unequal healthcare access, and the need for ongoing research and innovation. Success stories. Few countries like New Zealand and South Korea and Taiwan and Vietnam exhibit effective COVID-19 management measures and strategies. They included swift lockdowns, extensive testing, and a clear communication. Lessons we learned from this emphasize early action, robust public health infrastructure, transparent communication, coordinated efforts, technological integration, addressing inequalities, and global cooperation. These insights underscore the importance of proactive measures, efficient healthcare systems, clear messaging, collaboration, technological innovation, equity in healthcare, and international solidarity in managing pandemics and healthcare emergencies. Moving forward, we look at future directions, strategies for future pandemic preparedness and response. Global cooperation and coordination are essential to preparing for future pandemics. This involves investing in early warning systems, strengthening healthcare systems, and stockpiling medical supplies, prioritizing research and vaccine development, implementing communication strategies, and fostering partnerships are crucial. Workforce training and addressing inequalities in access to healthcare and resources are imperative. Learning from the past pandemics is vital for refining strategies and enhancing preparedness for future health emergencies, emphasizing the importance of a comprehensive approach involving diverse expertise and resources. Moving forward, conclusion of this global COVID-19 management. During the global COVID-19 crisis, comprehensive strategies like lockdowns, vaccinations, and healthcare preparedness were crucial. Health professionals' insights highlighted the challenges and the lessons we learned from them. International solidarity is pivotal in overcoming COVID-19. Sustained vigilance and cooperation are imperative for effective public health measures. Prioritizing equitable access to vaccines and healthcare resources remains paramount. As we navigate this pandemic together, let us remain committed to collective action, fostering resilience and ensuring the well being of all communities worldwide.
We would like to invite you all to students, and we will head to our discussion. Question number 1. How have global COVID-19 management policies evolved since the beginning of the pandemic, and what factors have influenced these changes? Global COVID-19 management policies have undergone significant evolution in response to changing epidemiological trends, scientific advancement, and lessons learned from practical experience. Policies shifted from lockdown and travel restrictions to vaccination campaigns, testing strategies, and targeted interventions to balance public health and social economic considerations. Okay, at this time, who would like to further discuss our question?
I'll go ahead. So, pretty much with the global pandemic that we experienced a couple years ago, which is crazy to say now, we didn't really have any measures set. So, it was hard to control our borders. We had a lot of issues with policy and strategy, but with everything going on now, we're hoping like if we ever come across the situation once more in the future that we won't have to deal with the burden of being in lockdown and everything like that. But overall, the beginning was very hectic, and I wish that we adopted more of the other countries' practices by having stricter set guidelines for closing the borders.
Thank you, Karizza. Who else would like to chime in?
Can add a little bit to it. I think that one of the things that we realized during the COVID-19 pandemic was that communication is extremely important, and being transparent and having a good communication system really does come a long way. I remember that here in New York, we had so many different things happening and being said at the same time. And of course, it was a learning experience because we had not experienced it before. But having people in government giving different directions to different types of populations was very really contributed to the way that people were following directions. In terms of the vaccines, we had governors that were against it, and then we had governors that were in favor of it, and that really made the problem bigger than what it was, because it really uh, led to people not following instructions as they should, or maybe doing their part, wearing a mask if they didn't want to get vaccinated, um, listening or sharing misinformation. I saw that a lot in the media and coming from all news sources. And so, as a government and as healthcare professionals, they needed to come to a good decision and communicate with each other so that you are able to share the accurate or the most helpful directions to the public so that they may do their best to help during this time.
Thank you, Blanca. Anyone else?
The trust in vaccines and public health guidance to our community. So, combating this misinformation, it requires promoting media literacy, fact checking, and amplifying some trusted voice like healthcare professionals, to listen to healthcare professionals and what scientists have to say in this, and scientists from around the world who shared openly about this variants becoming mutation and genetic sequence of virus early on helped. This transparency helped a lot in research and developing vaccines, to work on treatments and to work on patients simultaneously. That's it.
Thank you, Zuha. Um, I just will chime in that it was really unfortunate that the government could not decide what information they wanted to appropriately disseminate, which created more chaos than the whole pandemic itself. And even though President Biden now, more than a year ago, declared us no longer in a pandemic, we are still suffering from the pandemic. And you have families that still are not working, still cannot afford to, pay the rent because this pandemic went on so long. And I think that that went to the government hiding information that they had, feeding the public misinformation, which, didn't help any.
Yeah, I completely agree with you.
Matthew, would you like to chime in?
Um, I really have on this question. I really have nothing to add in. I think everything was already said.
Okay, that's fine. We will move on to question 2. What insights have health professionals provided regarding global COVID-19 management? Health professionals have offered valuable perspectives on various aspects of COVID-19 management, including disease and transmission dynamics, treatment protocols, and healthcare system readiness. Their insights have informed policy decisions related to lockdown measures, vaccination prioritization, and public health messaging, leading to more effective strategies for controlling virus spread. Questions? Excuse me, comments.
I have a comment in terms of the healthcare system readiness. I think that, um, at least in this country, we could see very clearly how our healthcare system was collapsing due to the lack of resources that we were unable to provide to our healthcare professionals. um, Here in New York, some of the hospitals, they had all over the country, they had very limited resources. But some of the things that I saw working in the hospital was that healthcare professionals had to reuse PPE, which was very unfortunate, using the same mask multiple days when they're dealing with multiple patients that are very sickly, in a pandemic where they themselves are putting themselves at risk, was very unfortunate. So relying on other countries' items, uh, medical items to share with the United States was very critical. And I think that also contributed to us knowing that we need to um, have a greater sense of where we are getting our resources from. Because if we are relying on other countries to provide that for us in the midst of a pandemic, when everybody all over the world is in need of these resources, we could really put our healthcare systems in a very critical place where it could shut down.
Yes, thank you. I just will piggyback off from you, Blanca. It was horrible to know that we were recycling PPE when we've already got a pandemic on our hands, and that is creating health issues. And well, you're not necessarily sick. You go ahead and you trade PPE with the next person. That person may not know if they're sick. And so rather than handling it, all the government did was shift blame. And here we are passing around all these sicknesses, and nobody's getting any better. And so it really was a shame to see, considering how many countries and how many people were affected. It really took a toll on healthcare workers, and that didn't help the public at all, help, keep anybody safe. So it just
Exactly.
overall was very, very sad.
Yeah.
Do we have any other thoughts?
I can go ahead. I know globally, since I'm Filipino, I remember my dad was at the Philippines when this whole happened, so borders were closed, and then they had a hard time getting the vaccination. So this reminds me of how fortunate we were over here to get it, even though there was like kind of like a chain where like, oh, first responders, and then like all the people who are working in healthcare facilities had to get it first and everything. And then later on, it became an issue where the children, they were wondering if the kids can also get the vaccination, but they obviously prioritized those of like a certain age. So the elderly, like at 65 and above, to get it first when we were living here in Maryland. So I can see also a difference too, because when we traveled back to California, where I reside now, I remember when we came to visit, not that many people at the airport were really wearing PPE. But I know when working back in Maryland, when we were stationed there, pretty much we had to follow all protocol because that's what the state mandated. So it's kind of crazy how each state also to have their own strategies and policies put into place. And again, like how Crystal was saying, it kind of leads up to like our president at the time, whatever the regulations were. It's just we don't really have a streamlined strategy.
Thank you. Are there any other thoughts before we move on?
I have a thought. I would just like to add on and say that health professionals provided enough insight that, for example, in my school, a lot of students were curious and confused on how to best manage COVID-19 because in classrooms, you're very compact and everybody is not 6 feet away from each other because each classroom is not ready and prepared for COVID-19 to exist. So it was a perfect breeding ground for COVID-19. But the information that was distributed to teachers eventually went down to us students, and we were able to wear masks. Lunch was expanded and shifted so that there would be less people in the lunchroom and in each class so that COVID-19 would not be spread. And if you had any symptoms at the time, you would basically be doing online work, which opened up Google Classroom and remote work. So you were able to do the work. You were able to do the work online, so you wouldn't technically be missing school by doing your work at home, which was the incentive for people to come when they actually did have COVID. You were able to still keep up with your work from the online standpoint. So there was a lot less people getting sick inside the school because people who had any symptoms would stay home and everything would be safe inside the actual school.
Yes, that is a good point. Thank you, Matthew. Do we have any other comments? Okay. Question number 3. What are the main factors contributing to the emergence of new COVID-19 variants, and how do they impact the effectiveness of existing vaccines? COVID-19 variants emerge from mutations in the virus's genetic material influenced by natural selection or immune pressure. They can alter transmissibility, severity, and immune evasion, possibly reducing vaccine efficacy. Surveillance is vital to track variant spread and adjust vaccination strategies. Comments?
Um, so this pandemic exposed weakness in healthcare systems and all over the globe. And because of unequal access to testing, treatment, and especially getting vaccines during the pandemic, it highlighted the importance of global health equity and how the virus spreads. And it did get spread all over the globe. And then the more the virus spreads, it has more opportunity for mutation. So mutations arise, and because of the factors like this, there are high caseloads of cases in the hospitals and low vaccination rates. They all contributed to emergence of new variants for the COVID-19. So healthcare professionals also called for like improved measures, the PPE and all of this depletion of materials and all in the hospitals is all made the vaccine made the variants to mutate and the virus to spread. Yeah.
Thank you, Zuha. I just will chime in. The mutation part about it sounds gross, I don't know a lot how different germs mutate, and I kind of really don't want to know because after this, I'm really grossed out. But the surveillance is definitely vital because if we are not keeping proper track of who is getting sick, where they are getting sick, who can take medicine, and all of these data statistics, we are not going to become aware of how many people died and how we can effectively improve these vaccines, considering that now the vaccine that they first came out with is no longer good. Now you have to get a new vaccine every year, like you do the flu. And I will just say that if data is not properly kept in track, we're not going to be able to help any other country globally, which is just going to possibly bring on another huge pandemic, which is just going to hurt everyone. So it is best to keep track of everybody who gets sick and keep up with the measures on what worked and what didn't so that we know how to combat this process if it ever should happen again. Would anybody else like to comment? Okay, we will go into the very last question. How has international collaboration among healthcare professionals influenced the effectiveness of global COVID-19 management policies? International collaboration has been crucial in sharing expertise, resources, and best practices to tackle the pandemic by developing comprehensive strategies. It has facilitated the rapid dissemination of information about effective treatments, vaccination campaigns, and public health measures, ultimately contributing to more coordinated and successful responses to the pandemic. Last final thoughts.
I'm hoping since the whole pandemic that we learned how to work with other countries and nations, like strategies and everything. So I think the issue that we initially had for sure is public health messaging. I wish that could have been streamlined better in the beginning. It just brought like a downfall where people started like Googling stuff and not knowing where to get the information. And it's just unfortunate that we didn't have anything streamlined at the start.
Do we have any last final thoughts and contributions?
I just wanted to add on and say that, for example, if you do have if you have like a disease, COVID-19, for example, it will produce variants based on how much it spreads. And these variants, there are doctors across the world working on treatments and how to create a new vaccine and a new cure to the variant. And international collaboration among healthcare professionals could allow, for example, let's say Dr. A has, like, there's three doctors, Dr. A, B, and C, that cure the variant for different countries. So let's say the Dr. A, which would be, let's say, in America, has the variant, an effective vaccine to the new variant that was created. So if there's a doctor in Africa struggling to cure its patients, the doctor in America could contribute and they could communicate and collaborate to make sure that everyone has the most effective vaccine to the new variant that is created. And if this process continues, because there will always be new variants to all diseases, if everyone stays communicating and the variants will become the people getting the variants will become more healthy because the vaccine effectiveness will stay at a high, since each doctor has access to the best possible vaccine that they could give their patients.
Thank you very much, Matthew. Anybody else?
I would like to say that the best thing that happened during this COVID-19 pandemic was the development of rapid diagnostic tests and at-home testing. That helped a lot. I was traveling during the COVID time, and because of the rapid diagnostic test, I could test whether I have it or not, and I could travel. And what the other thing was the global international healthcare and health professionals collaborating with each other. That was also a very good thing. I remember very clearly. I was appointed for some 15 to 20 patients too, as a healthcare professional. So I was doing telehealth. So I used to talk and I used to give them the basic prevention measures, tips and all, because many of them the lower income communities and the communities who don't know what to do, they were relying only on telehealth because we cannot ask them to come to hospitals and all. So I had to call to one of my brother who was in UK. He's a pulmonologist, saying that no, this person has, this kind of. I think his health is health condition. His lungs are exaggerating, and also he used to say no. Ask him to get a scan, get tested, and they had to move into hospitals. So this rapid development, rapid diagnostic tests of the COVID-19 helped a lot to many people, and this collaboration for healthcare professionals. It fostered an open sharing program, like sharing, like we got to know about this variant now that this is developing this much, and this is showing this patient is showing this symptoms, but it's not the same for the other patient having the same symptoms. So each and every body reacts in its own way, and the virus is reacting its own way to each and every patient. So, so this was it.
Thank you very much. Blanca, do you have anything you'd like to add?
I think that international collaboration is like an essential part of managing a pandemic. I think the cultural aspects can be very helpful as well. Cultural behaviors can really contribute and also like teach us new things. I think that one of the things that I can really say about what Americans learn is to wear a mask when you're sick. uh, so many people do not wear a mask when they're sick. And I think that now, the moment you start feeling a few symptoms, even if it's just a cold, it's sort of like a courtesy that people have learned is to wear a mask so that you don't get other people sick. It's really a courtesy. And I see it often now in the trains and the buses, that you see certain people that they wear their mask if they're not feeling their best. So that was something that we learned very well, because I think in Asia, that's something that's kind of normal. uh, you don't want to get someone else sick, you wear a mask. But here in America, there's a lot of people that did not wear masks, and I think that was a good lesson to learn for a lot of people here.
I agree. Carissa?
I just want to say I agree with Blanca 100% because we even traveled this year. We went to Taiwan, and then everybody over there, all of their public transportation, everyone's still wearing masks, but it's also part of their culture too when they're sick. So I honestly think, like I was talking about it with my sister-in-law, I think it should be a standard because as a nurse, I you just don't want to be around your patients. And then when you see people cough now, like it's like kind of getting a stigma, like oh no, be scared. Not like before, like a simple cough, people would be like oh it's kind of whatever, maybe allergies, but it kind of puts a like a misconception also too. But I agree though, still I just disregard all of that. Wearing a mask, especially when you're sick, or even just taking the time to simply call off, do proper PPE, and then washing hands especially. I know a lot of kids also here are like germaphobes too, so, and then including myself, but then kids are germs and they're sponges, so what can we do and how can we streamline it? Again, public health messaging.
At this time, we would like to thank you from Assuaged Foundation for joining our student team on the global COVID-19 management policies and health professional perspectives. We hope to see you again in a couple of weeks for our next presentation. Thank you very much and enjoy your evening.